Good morning. I'm Dr. Yoldas. I'd like to talk to you about ACL injuries. We all tend to hear about it, but we're not quite sure what it is. The ACL sort of stands for anterior cruciate ligament. And what that means is within the knee, we have the thigh bone, we have the shin bone. If we move this around, we have a rope that holds the two bones together from the femur down to the tibia right in here, and it helps hold them together. When that ligament is injured, it can allow motion within the knee, or what we call instability. You don't need an ACL for life, but to be active, you need it. Otherwise, your knee will be left with pain, discomfort, weakness, or even sometimes a lack of confidence. But if all you do is you walk, you bike, and maybe even swim, you might do okay. But for the active individual, whether 15 years old or 50 years old, you need to have that knee nice and stable. Another reason is we do know that without that ligament in place, if this knee keeps moving and shifting, you can damage the cartilage that's present within. So for most active, healthy people nowadays, fixing it, or what we say reconstructing it, is the right answer. There are three different ways to make an ACL. One, using your patella tendon graft. Two, using hamstring tendon. Three, using cadaver tissue. We won't go into the details of each of that. That is usually individualized with the surgeon and with the patient. Nowadays, however, for the past 3 years, what we've been adding is a structure within the graft material called an internal brace. That structure adds support to the tissue as it is healing, because during the remodeling process that the graft undergoes, there can be some elongation or stretching out, and this prevents that. But also further on, once it is completely healed, that internal brace acts as sort of a belt and suspender that if there is stress or injury, that it prevents further re-tearing. We've been doing it for about 3 years and have not had any re-tears of our ACL grafts. So it's been a wonderful adjunct to it. When you have ACL surgery with us, the surgery itself to reconstruct the graft material takes typically about 30 minutes or less. Speed does not equate with excellence, but when you're efficient, you can move through the surgery pretty quickly. It's done as an outpatient, go home the same day, crutches and brace for 3 weeks. By 6 weeks, walking without a limp. By 3 months, begin running and jumping, and by 6 months, begin cutting and pivoting. One is not competition ready at 6 months, but you can slowly transition over the next 3 to 4 months after that into competition or more aggressive activity. So for all the injuries that I see day to day, having an ACL tear in a funny way puts a smile on my face because it's very solvable. When handled by the right person, in the right clinic, with the right therapy, you can have an excellent 90 to 95% chance of full recovery. So any questions about ACL reconstruction, we'd be glad to meet with you and help you through your recovery process. Thank you.